New details on that deadly hantavirus outbreak linked to a cruise ship. A patient in France is fighting for her life, and here in the U.S., doctors are monitoring dozens of people. Our Denise Sidor is here now with the latest. Denise?
Well, as you can see, the number of states where residents are being monitored, well, it's expanding. Health officials from Maryland to California are keeping a close eye on Americans who are isolating at home. Some left the cruise ship before the Andes strain of the hantavirus was identified. Others were exposed to these passengers aboard airplanes. Today, I was on a call with the CDC where I got an update on American passengers in Nebraska. One is a retired physician in the biocontainment unit. Dr. Stephen Cornfield says he was on a vacation of a lifetime when he was asked to help out with sick passengers. His initial tests done in the Netherlands are now being called inconclusive. The CDC is working to get a more definitive result.
It's still possible that that test represents evolving disease, and I will get symptoms down the road. This is why I'm in the biocontainment unit. I'm not ill, but the term I hear a lot is abundance of caution. I'm here to be monitored closely.
The test that we initially got, there was a positive and a negative. From our standpoint, we wanted to redo the test to ensure that we had a test that was done here and we had the results.
Meantime, a French woman with hantavirus is in critical condition on life support. She's suffering life-threatening heart and lung damage. And worldwide, there are 11 reported cases, including 3 deaths. The CDC is encouraging those in Nebraska and the couple being watched in Atlanta to stay through the totality of the quarantine process, which is 42 days.
Well, speaking of the 42 days, okay, so that started on May 11th. Do these people who have been exposed have to stay in quarantine or stay at home that whole 42 days? That's a long time.
It is. 42 days is the recommended time given to us from the World Health Organization and the CDC. The people at the federal facilities, they are under a federal watch, but they too could go home if they test asymptomatic. They're going to be decided on a case-by-case basis. The ones at home, that's voluntary. They're working with public health officials. They want to make sure that everybody stays safe. They're keeping an eye on them.
Yeah, better safe than sorry.
Yeah.